Alzheimer's should be a rare disease.
We now understand that Alzheimer's is a preventable disease in the first place.
You are not stuck with the brain you have. You can make your brain better.
Hello, I'm Peggy Sarlin, and today I'm in Grosse Pointe, Michigan, where I have the pleasure of speaking with Dr. Pamela Wartian Smith, who is going to tell you exactly how you can figure out what is causing your memory problem. Dr. Smith is the author of an excellent book. I have it here. It's called What You Must Know About Memory Loss and How You Can Stop It. And she is a diplomate of the American Academy of Anti-Aging Physicians. She's the owner and the director of the Center for Personalized Medicine, and she is a well-known authority on wellness and anti-aging. So, welcome, Dr. Smith.
Thank you very much.
Let's begin by talking about if a patient comes to you with any kind of a memory issue, what's your goal? What's your ultimate goal when you treat them?
Our goal is to look at the cause of the problem and not just treat symptoms, and to develop a very customized and personalized approach for every single patient.
Well, that's why you do personalized medicine. Now I get the title. So the fact that you want to get to the root cause is a little bit different, because many times we see doctors treating symptoms and not going deeper into finding out what's causing these symptoms.
That's really the good news in medicine in 2016 and beyond. We really can look at the cause of many disease processes, including cognitive decline.
Okay, so how are we going to do that? Somebody comes in either for themselves, or maybe they bring their spouse, or they bring a parent, and this person, something is going wrong, maybe even seriously wrong. What's your checklist of figuring out the source of the problem?
Most kinds of memory loss are inflammatory in nature. Inflammation's good if there's a small amount because it helps you heal, but too much will cause a problem in any place in the body, including the brain. So we do look at causes of inflammation. They can be hormonal, as a hormonal imbalance. They can be related to heavy metals. There's many different avenues. Memory loss really is a multifactorial problem, and so we just go down the road of looking at each of these in a very customized approach.
Well, it's interesting that you say it's multifactored, and that means that the answer might involve many different factors rather than looking for that single magic pill that's going to do everything for you. You're going to come at it from several angles.
We are. For example, if we're looking at women or men, we do know that hormonal function has a lot to do with memory. For example, for men, testosterone literally equals memory. So if testosterone has started to decline, we want to measure it and replace it appropriately. The same thing for women. Estrogen equals memory, and so we measure and replace appropriately with the right kinds of estrogens. There's even a hormone of memory, and it's called pregnenolone. Have you ever heard of that hormone?
Well, I have, because I read a lot about memory in the brain, but most people haven't. I think most people know estrogen and testosterone, but they don't know, okay, you pronounce it for me.
It's so funny to me that the hormone of memory would be hard to say, pregnenolone, and hard to spell. To me, it's
hard to remember.
It is hard to remember.
It's hard to remember. But what does it do for us?
Well, it's the mother hormone. So it actually makes estrogen, progesterone, testosterone, DHEA, and cortisol our hormone of stress. And stress plays a very large role when it comes to memory, whether you had stress as a child, stress when you're 30, stress when you're 60, that all plays a role. We can measure your stress hormone cortisol. It is a salivary test. And if cortisol is not normal, the good news is we can normalize it and balance it in every single person.
Well, that's tremendous news that you're bringing us. So just to review for a minute, let's go back to cortisol. Cortisol is the stress hormone, And you can measure it. It's saliva. That's not too scary. You spit into a cup or something like that. And you can solve the problem of too much cortisol. So how do you do that? How do you balance it?
Well, when you're first stressed, cortisol elevates. When you stay stressed for a long time, it becomes too low. You have to have cortisol to live. If you don't have cortisol, you die in 7 days.
7 days?
In 7 days.
Oh.
So it's a must for living. So the body will make cortisol above all those other hormones. So for example, you could be 37. Your pregnenolone level, the hormone of memory, could be 5, which is very low due to stress. And so stress is the cause of the problem. We want to deal with that hormone. When cortisol is not normal, cholesterol can go up, blood pressure can go up, blood sugar can go up, the immune system becomes compromised, thyroid, the hormone that regulates everything in the entire body, may dysfunction, people put on weight, and stress. I mean, who isn't stressed in today's society? So we measure cortisol in everyone. It's a great place to begin for any disease process, but particularly for memory.
Very, very interesting to know. So somebody comes in, let's say, and they're experiencing memory problems. You measure their cortisol, and let's say something's wrong. From what you were saying, it sounded like either it might be too high or too low. You might see either one.
Correct.
Now what are you going to do?
Well, first of all, we put people on a multivitamin, a good pharmaceutical grade one if they're not on a pharmaceutical grade vitamin, because the adrenal glands, the glands that sit above your kidneys that make cortisol, need basic nutrients that are in a multivitamin. Of course, we want people to eat well, but as we age, the body makes less of some nutrients. So we begin with a multivitamin.
Could I just stop you there? You said pharmaceutical grade. Does that mean prescription? Is that what it means?
It doesn't, but what it means is two things. Pharmaceutical grade is when the nutrient is guaranteed to be 100% pure with outside verification, and it's also what we call bioavailable, meaning that it gets into your body and it does what it is supposed to do.
Right. So do you recommend specific brands? Is that something you would feel comfortable doing? Or
we do recommend great brands, and the brands that we recommend have clinically controlled trials that actually show us that the nutrients get into the body and do what they're supposed to do. 3 main nutrients decline with age, starting at about the age of 50. Coenzyme Q10, alpha lipoic acid, and L-carnitine. All of those nutrients are fueling sources for the body, including the brain. And so they're all very important for cognition. We can go back and measure them, but they need basic nutrients to make them. Also, when it comes to stress, we give adaptogenic herbs, herbs that help the body deal with life. So ashwagandha, ginseng, rhodiola are some great adaptogenic herbs, which means that it works if cortisol is too high or too low.
So this is an important point, I think, for people to understand, is it's adaptogenic because it's going to help your body adapt. Whether too high, too low, it's a tonic.
It is a tonic. And it's so important that people also understand that cortisol takes a long time to balance. When it comes to pregnenolone, within 90 days, we can usually balance that. But if people are really stressed, it takes 1 to 2 years to normalize cortisol.
Oh, whoa. That's a lot of time.
It is, but stress reduction techniques are also important. Prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques. Even if a busy person says they have no time to do stress reduction techniques, they can sit at their desk and take deep breaths and let them out. Great stress reducer for today's world.
And if you reduce your stress, this is going to help bring back your mother hormone that you mentioned. I can't remember the name. The one who's
It really is funny that it's named pregnenolone, isn't it?
Pregnenolone. That you'll see results sooner in terms of that hormone than the cortisol. The cortisol is going to take a longer time to find the proper balance.
It does, but we can help balance it. The other thing about cortisol that's really important is that it affects blood sugar and the hormone insulin. And the research worldwide now, when we look at memory loss, is focusing on the hormone insulin. There are insulin receptors in your brain. And so if you have too much insulin or too little, it can negatively impact your memory.
Well, this brings up the topic usually of what to eat in order to, when you're talking about insulin, you're talking often about food and healthy diet. Is there a recommendation you make to your patients? Is there an across-the-board recommendation, or you tailor it to individual people?
Really both. If we're going to make an across-the-board recommendation, then we usually recommend the Mediterranean diet, because it's anti-inflammatory and it works well for most people. But the science is now here to do genetic testing, where we can literally measure your genomes and see what's on them and tailor-make an eating program for you.
Wow.
And exercise, because exercise maintains memory. So we can do genome testing. When I did my own, it was really, very fascinating. I do not have what's called the sprinter gene. If you have a sprinter gene, exercising will help you maintain your weight. I don't have that gene, so I can exercise every single day. It will not affect my weight, but what I do exercise for is to maintain memory. I was really lucky. I got to meet Jack LaLanne before he passed away. So I said, hey, Jack, how do I learn to like exercise? Because I truly do not like it. I do not get the high that some people get from it. He told me the most amazing thing. I don't like exercise either, but I love the results.
Jack LaLanne
He did not like exercise.
Well, there's certainly a man who compensated. Okay.
He did, but it maintains memory. And it doesn't have to be pumping iron to maintain memory. Studies have shown that things like ballroom dancing is great exercise and helps maintain cognition.
I'm going back to what you said about the gene analysis. You're saying now, this is totally new to me, you can get genetic testing that says, oh, this is the right exercise program for you.
Yes, and the same thing for how you eat. It's actually on a gene, and sometimes people have something called a SNP, a single nucleotide polymorphism. You can just call it SNP.
That's easier.
Okay. It is much easier, and it determines our taste, whether we can taste bitter or sweet. It determines our cravings. Like some people have sugar cravings. They have a hard time turning off. It determines a whole battery of things, whether we get inflammation from the foods we eat. All of that can be tested now with genomic testing.
How new is this? I mean, this is really new, isn't it?
It's very new. In our personal practice, we've been doing it for 4 years now.
I see. Well, the idea that you could figure out from your exact genetic testing, this is the right diet for my body, this is the right exercise program for my body. It's extremely exciting.
It is, because when it comes to memory, it's really 5 things that are important.
Okay.
1, how you eat. And nobody eats perfect. Okay.
But you have to eat right most of the time.
Correct. It's
Not
that
all the time.
80-20 rule or 90-10 rule. I happen to have a sweet tooth personally, so every Sunday afternoon I have something sweet. But I don't eat it every day. So this last week mine was a hot fudge sundae.
But it was on Sunday, and that was it for the week.
And that's all I ate for the week.
Right.
Now, the week before that, I cheated slightly because it was my birthday.
Oh.
So I had 2
okay,
things.
Happy birthday. Okay.
Thank you. But eating right is really important. Exercise is important to maintain memory.
I was going to ask you, but let's talk about exercise, because this is a new idea that our bodies are genetically programmed to respond to in different ways to different what works for somebody else may not work for you. So you hear a lot of different advice, the stretching, the weight bearing, the cardiovascular, aerobic, whatever. And how often you have, what's the minimum for people who want to maintain their memory and don't like exercise? What's the minimum?
Well, 2 studies have been done which are a variety. So again, it's probably personalized. One very recent study showed that if you do advanced cardio, meaning you really do double your pulse for 20 minutes, that once a week is enough.
Oh, once a week. Well,
Once a
that's
week.
good news for people who don't want to do that.
It is. More commonly, the studies have shown 3 times a week, doubling your pulse for 20 minutes is perfect. Now, it takes a little longer because you should warm up and cool down. And if people are over the age of 50, we do recommend that they see their primary care doctor and have a stress test if they have not been exercising before they begin an exercise program.
And that's because of potential heart issues?
Absolutely.
If they start suddenly getting on that treadmill and getting into a sweat and, yeah, okay. All right, there were 5 things you said about memory. So where are we? We were going to eat right and we were going to...
Exercise.
We were going to exercise.
Sleep is key for memory. When you don't have good sleep hygiene, meaning that you don't sleep at least 6.5 hours to 8 hours a night of good restorative sleep, it drives up your blood sugar. And it's one of the mechanisms that causes memory loss. So sleep is important, hormonal balance, and then to be nutritionally sound.
Going back to hormonal balance for a minute, did we completely cover how we were going to bring the cortisol into balance? There was stress reduction techniques. Oh, it was the adaptogenic herbs, things like rhodiola and ashwagandha, and other tricks there to manage the cortisol problem.
If people are stressed and wired, because some people are more wired, and we want a nice balance, then we give calming herbs too, like lemon balm, chamomile. So some people need those, some people do not. It's really all about balance.
Well, I noticed when you said you were going to calm people down, you were going to give them these natural herbs, you weren't going to give them prescription drugs, you weren't going to give them Xanax or whatever. Is that correct? Do you even use those drugs in your practice?
Well, I believe in traditional medicine. So I use almost every single medication that you can imagine in a very personalized approach. But if I can have people eat better and sleep better and exercise and have hormonal balance and have the right nutrients, many times people don't need medication.
Which is preferable, which is truly preferable. Okay, eating right, we're exercising, we're balancing our hormones, was that it? Mm-hmm. Sleep and stress, is that all 5? Did we cover all 5?
Well, eating right.
Right.
Okay. Exercise, sleep, hormones, and nutrients.
And nutrients. Now, let's talk about the nutrients. Are there supplements you would recommend? Let's say you're over 50. Are there supplements just as a neuroprotective thing, just to be good to your brain in the future that you should take on a daily basis, even if you're eating well?
Well, the perfect answer to that is that we can do a test and measure the level of 37 vitamins in your body. We can measure amino acids, fatty acids, organic acids, which are pathways that help with cognition and the rest of the function in the body that require nutrients. But to give you a simpler answer to that, really everybody should be on a multivitamin.
Okay.
They should be on a probiotic, good bacteria for their gut. And they should be on omega-3 fatty acids like fish oil or some other kind of omega-3 fatty acid. That's probably the bare minimum that people should start with.
That's like your basic black in your wardrobe. That's what you need on your kitchen shelf to take every day. In your book, you have an interesting structure where people can answer questionnaires to try to figure out the source of the problem. So you begin with cardiovascular. So what are some of the questions that you have people answer about the cardiovascular system that might affect their memory? So they can start figuring out, maybe that's where my problem's coming from.
Well, from the viewpoint of heart health or cardiovascular disease, the vessels in your heart, same kind of vessels that run to your brain. So if you have hardening of the artery in the heart, you have hardening of the arteries in your brain.
They're connected.
They are connected. And so heart health equals brain health. Brain health equals heart health. And when we look at cardiovascular, particularly for women, sometimes it's a difficult discussion because women usually, if they have an impending heart attack or if they have vessels that are clogged, they don't get crushing chest pain, hardly ever. Women may get nausea. They may get shortness of breath. They may have pain on the right shoulder and not on the left side of the chest. So what we try and do is recommend that everybody at 50 have a stress test and an EKG to look at the basics of their heart structure. Also, when we look at cholesterol, cholesterol is not the only risk factor. One half of people who have a heart attack have very normal cholesterol. So there's other risk factors to look at.
And what are those?
One of those is homocysteine. Homocysteine is an amino acid, and if it accumulates in the body, an increased risk in heart disease and stroke, depression, breast cancer, prostate cancer, and memory loss.
And what's going to cause those raised levels?
Some people are born with a gene where they don't break down B vitamins well. B vitamins, particularly B6, B12, and folate, lower homocysteine. But people can have that SNP we were talking about, that single nucleotide polymorphism, where they can take B6, B12, and folate, and it does not break down homocysteine. They will need a more activated form, like MTHF, which stands for methyl-tetrahydrofolate, or TMG, which stands for trimethylglycine. It's part of what we call the methylation pathway. And so it's really important for all of those reasons, including memory, that we normalize homocysteine to between 6 and 8.
Is this something a regular family doctor would look for? Would they check your levels of homocysteine?
Probably not at this point. Certainly if you saw a specialist in the field of anti-aging, regenerative, functional medicine, any of those, metabolic medicine, then they would look at this. In the future, every doctor will be looking at homocysteine.
But okay, people who are watching this can get ahead. They can get into the future now. They know they want to get that test. That's crucial to understand what your current homocysteine level is in terms of your cognitive health.
It's very key. It's a blood study that you can have at any major lab. It is a fasting study, so you fast for 8 hours before you go in, but it's very readily available, and we can normalize it in everyone. You also don't want homocysteine to be too low. Too low is not good either. It's all about optimal levels of everything.
Optimal. We're trying to optimize your brain here and your heart and your overall wellness. That's the goal.
With other markers, there's also CRP, or C-reactive protein. That's a marker of inflammation. So if the HS, meaning heart-specific CRP, is high, then that means we have inflammation in the vessels of the heart, but also probably the brain. So we want the CRP to be 1 or below.
Okay.
That's the perfect level. In fact, many researchers believe that high C-reactive protein is the major risk factor for heart disease.
That is the risk factor. Most people don't even know about it. And if you have a high level of that, chances are the inflammation is in your brain as well.
It is. The good news is we can normalize that in everyone.
How do you cool it down? How do you bring down that inflammation of
Well,
the
we want
CRP?
the level to be 1 or below. If it's slightly high, then we can use anti-inflammatory things like omega-3 fatty acids, or anti-inflammatory. It's probably how statin drugs work. Statin drugs are also anti-inflammatory. We can use many other things to decrease inflammation, like green tea. 3 cups of green tea a day would be very helpful. Curcumin, turmeric. There's many anti-inflammatory herbal therapies that we can use as well.
So if you take these anti-inflammatory herbs, they're going to cool down this CRP, that's going to show up in your blood test, so you'll be able to measure that and see how you're doing, right?
You can. Let's say it's 3. And so we'll give you some omega-3 fatty acids. Probably 3,000 milligrams would be a great place to start, which is fish oil. You can use other omega-3s as well. And so that will bring it down usually in about 30 days to 1.
That's good. We like that. That's not like the cortisol. We're twiddling our thumbs for 2 years. Okay, 30 days.
This one's quicker.
Okay.
Some people have a really high C-reactive protein. So perhaps it might be 28.
Wow. And it's supposed to be 1?
It's supposed to be 1.
Yikes. Okay.
And so if it's really high, that usually means that there's an infection in the blood vessels. And so we give a traditional antibiotic to clear up that infection, and then the C-reactive protein goes down.
So when you're looking for cardiovascular problems, these are the tests that you do. You're looking at these biomarkers of these, the CRP, the homocysteine. What are some other ones?
We look at fibrinogen, which is a clotting factor. We look at ferritin, which is iron, particularly in men. If iron elevates in men or women, it increases the risk of heart disease, but that issue is more common in men than it is in women. We can look at other inflammatory markers like TNF-alpha, interleukin-6. The good news is they're all blood studies, they're all available at almost every major lab, and we can normalize all of them.
It's very good news, because if let's say this is the source of your memory problem, and you take care of it with these not very scary sounding remedies, drinking green tea, taking krill oil or fish oil, or some of these other things you've mentioned, then we're not only protecting our heart, we're protecting our brain, and we're going to feel better.
We're going to feel better because, again, it's all about balance.
We're going to feel more in balance. We're physically going to feel more in balance.
We are.
We're going to have more energy.
We're going to have more energy. Again, a little bit of inflammation heals. That's why if you fall down and you sprain your ankle, the inflammatory process occurs, the ankle swells. It's part of healing, but you're not supposed to stay inflamed.
Right. Now, another possibility that you mention in your book for memory problems is that there's been some kind of toxic exposure, heavy metals or something like. Can you help us understand how that might manifest and how you might find that, how you might diagnose it?
Toxic metals are becoming more of an important issue with people worldwide. And to how you diagnose it, it is a urine test. And you take what we call a provocating agent beforehand. It's a chelating agent, usually a pill. And you take it about an hour before you do the test, and you collect your urine for 6 to 24 hours. It's very important that you're on a multivitamin for 30 days before you do the test, because when you take that chelating agent, it takes the minerals out of your body along with measuring your mercury and all the other toxins.
Oh, I see. So you're going to be depleted unless you're taking the vitamin.
Yes. The really new studies are showing that when it comes to diabetes, that toxic metals play a major role.
Let's talk about this for a while, because diabetes is such a gigantic issue, and because people who have diabetes are dramatically more at risk of getting Alzheimer's and cognitive problems. So now this is a whole new way to think about diabetes, I think.
It is a whole new way. So more and more we measure toxic metals in patients, and we can chelate them out. When we look at chelation, if it's very high levels, we do IV. But many people just have a moderate amount or low, and we can give oral chelation over a number of days to lower the lead, mercury, and other toxic levels like cadmium. They can all negatively impact memory. But your point is very well taken about diabetes, because sometimes people don't realize there's really 3 kinds of diabetes. There's type 1, where people don't make insulin at all. There's type 2, which is what 95% of Americans have that have diabetes, where they make insulin, but it doesn't work effectively in the body. But now there's type 3 diabetes, and that's Alzheimer's disease.
And this is a new way of thinking about Alzheimer's as well.
It
which
is.
is that it's diabetes of the brain.
It is diabetes of the brain in many ways.
And you're saying that a source of that could be an exposure to metals?
Yes. There was a major pilot study that was done that actually proved this. So now there's a multi-center trial going on. And the early results of that trial are confirming that for some people, blood sugar elevation is very much related to toxic metal exposure.
This, I think, is important news, and how can people avoid that exposure? Is it in there? Where are they getting this exposure from?
Well, it's hard to totally avoid. It may be in their drinking water. So purified water is always the best choice.
Okay.
They may have toxic metal exposure from their pots and pans. It can come from aluminum cans. I mean, there's many ways people can get toxic. And the body does handle some toxins, but the body can become overwhelmed. We now have the ability to also measure PCBs and dioxins and look at plastics, meaning phthalates. We can measure all those levels too now.
And not only measure them, but then you can treat them with chelation. Is that essentially how you do that?
With toxic metals, we use chelation. With PCBs and dioxins, they're doing studies to look at the best ways. Infrared sauna is one of those.
Tell us about infrared sauna.
Well, infrared sauna is slightly different than what you might think of as a, quote, sauna in your house, but it's a special kind using infrared rays, and you sit in your sauna either at home, your doctor's office, or a medical spa, and you basically 3 times a week is a good period of time have a sauna treatment, but it's done with infrared rays as opposed to other modalities.
It's not dangerous at all?
It's not.
It's pretty much risk-free?
The only time it's not risk-free is if you do an infrared sauna and then you jump into cold water.
Oh, okay.
Okay.
So don't do that.
Don't do that.
These are very new ways of thinking about some extremely common medical issues, such as diabetes, to think that it might have come from your aluminum pans or from your drinking, from accumulated toxins that have built up over the years. And so this is new.
This is new. The studies are brand new, really important, but that doesn't stop the importance of eating a healthy diet, and exercise lowers blood sugar as well. Stress can cause blood sugar to elevate. Even if you don't have a family history, you can still become insulin resistant or develop diabetes if you put your body in a bad environment.
Let's talk about, you've raised the issue that we're much more sophisticated in looking at our personal genetic structure. Some people are genetically predisposed to Alzheimer's. It runs in their family and they have a genetic marker for it. So if they come to you, somebody who, how do you tell if it really is Alzheimer's? I have a specific question, which is, it's been an ongoing issue that people have been diagnosed with Alzheimer's, and then afterwards, after their death, it's been ascertained they didn't have Alzheimer's at all. So is the imaging better? What's the state today, currently, of figuring out with accuracy if somebody has Alzheimer's?
It's a diagnosis of exclusion, meaning that we can do a PET scan, we can do a SPECT scan, we can do a functional and traditional MRI that will give us hints, but there's not one particular test that says, hi, this is Alzheimer's disease.
I see.
So it's what we call a diagnosis of exclusion, where we look at other things that could cause the symptoms the person is having.
Okay, so there still doesn't exist that beautiful, perfect imaging system or whatever that's going to tell us, yes, in fact, this is Alzheimer's.
No. On SPECT scan and PET scan, you can see changes in the brain that occur with cognitive decline of all varieties. But those same changes can occur due to medications and other things.
Okay, so somebody comes to you, and what's going to make you, what is the constellation of symptoms and biomarkers, et cetera, that's going to make you say, yes, this person in fact has Alzheimer's?
We spend a long time with our patients. And it does take a long time when you're interviewing someone to really see where their memory is. There's traditional tests we can do that are very simple, like, here's a drawing, please reproduce it for me.
Right.
We can have you count backwards by 7 starting at 100. Sometimes I just have fun with my patients and I'll say, hey, what's going on in the world of politics today? Or what new thing have you read about recently? If they say they never read, then I start worrying. because that's one of the signs of early cognitive decline, is that people stop reading because they no longer remember what they just read.
Right,
And so
the
they just-
short-term memory goes. So
It does.
Just to remember the sentence before is too much.
It is. So if I say, hey, when you were 25, how many books did you read in a year? And you said, oh, I read 10. And then I'll say, well, you're 67, how many books did you read last year? And you say to me, you didn't read any. Then I want to look further into what is happening with your memory.
I see. Okay, so you're looking, since there isn't this magical imagery, you're looking at exclusion. You've ruled out other things, and you're observing them and giving them, counting backwards from 100 and different things like this. Okay, let's say you come to the determination, yes, this patient has Alzheimer's. Let's say early stage Alzheimer's. How are you going to treat them? How are you going to get them better?
We want to offer them every modality that's available. So commonly they are put on a medication to stabilize memory loss. We do measure their hormones, and we optimize them as much as possible. And studies have shown that testosterone and DHEA for men and pregnenolone, and estrogen, DHEA, and pregnenolone for women can help prevent memory loss, but can also stabilize memory loss. In a couple of studies, maybe mild reversal of memory loss, including Alzheimer's disease. So the idea is, how can we stabilize it? Normalizing blood sugar, looking at toxins is very important. There's also infectious causes. You were mentioning earlier that some people were diagnosed and then they really didn't have Alzheimer's.
Right.
A big one now is Lyme disease.
Lyme disease, yeah.
Lyme disease is huge. It can affect the brain and cognition. If we go back and we treat that, then we may be able to retrieve some of the memory. Parasitic infections. It is globalization of the world. People travel everywhere.
And they come back with parasites.
They do. And then that can invade the brain as well. We give them an anti-parasitic agent, good bacteria. Those kind of things are reversible causes of cognitive decline commonly.
And I think it's fair to say that people can have more than one thing wrong with them at the same time. And so, again, the approach of coming at it from multiple angles. There's so much to think about here. We've learned so much from you. Do you have does anybody spring to mind of a patient, a story of somebody that you've helped that you've seen their memory come back and their cognitive function make a really good recovery?
Yes. One of them is my patient, Sally, and she allows me to tell the story because she's so thrilled about it. When Sally came in to see me, she had an 8 a.m. appointment, and she showed up at 12 noon.
Oops.
She lived 4 blocks from this office. 4 blocks. And she couldn't find her way here.
Oh, she couldn't find...
For 4 hours.
That sounds like Alzheimer's. I mean, one of the first things is losing your sense of spatial orientation.
It does. It sounds just like Alzheimer's disease. And the reason she was coming to our practice is that her doctor noticed she had some memory loss. And so she came in to see us, and we ended up decreasing inflammation. We normalized her blood sugar. Her thyroid, which regulates all the hormones in the body and everything else, we optimized function. She ended up being low in estrogen, progesterone, testosterone, DHEA, and pregnenolone. We optimized all of those, and within about an 8-month period of time, not only could she find our way to the office, her son was a world-class chef. She ended up opening up a restaurant with him, which is a 5-star restaurant.
Whoa.
Yes.
I like that punchline. How old was Sally?
Sally was 67 when she came to see us.
And how old is she now?
Sally is now, oh gosh, she's almost 80, just shy of 80.
I needed a moment to process. When she was 67, she couldn't find her way 4 blocks here. She's now 80 and opening up 5-star restaurants.
And her husband died many years ago. She has a gentleman friend she travels around the world with.
We should all live as well as Sally. Sounds good. Well, I want to thank you so much, Dr. Smith, for sharing this really remarkable information. There's so many nuggets here, and there's so much news. There's a lot to think over. And thank you for watching, and I hope you learned from Dr. Smith. I hope you read her excellent book, which again is called What You Must Know About Memory Loss and How You Can Stop It. And I hope you found new avenues to explore how to protect your brain and how to regain memory that you may have lost. So, thank you.
That last interview was so helpful. Don't you agree? Hi, this is Peggy Sarlin, back at Regain Your Brain's main office. And I just love speaking with practitioners like Dr. Smith, who are working with real patients every day and succeeding. People really are reversing Alzheimer's and getting better. Doctors like Dr. Smith are getting the job done. And as you saw, there is so much that you can do. Tomorrow's episode is with Dr. Mary Newport, who really is one of the pioneers in reversing dementia with safe, natural treatments. You may have seen her in our first interview series or read her best-selling books. She's a hero to so many people who have Alzheimer's and to their caregivers because she's the doctor who found out that coconut oil could bring back memory and mental function. The story of how her husband Steve improved so much thanks to coconut oil is world famous now. Dr. Newport stumbled across the coconut oil treatment when she was desperately looking for something to help Steve, who was slipping into dementia when he was only in his 50s. And coconut oil was so effective that Steve said it was like a light switch came on in his head the very first day that he started taking it. And since then, thousands of other people have had that same experience, thanks to Dr. Newport. She has worked and she has fought to bring all of us the news about this life-changing remedy. She's a medical doctor, but quite frankly, most of her fellow doctors had no interest in coconut oil. She used to go to medical conferences and stand in the halls handing out information about it to anybody who would listen. So even if you're familiar with Dr. Newport and her work, you're going to learn a lot in this new interview tomorrow. These days, there are many different coconut products and many different ways to take coconut oil, and she showed them to me during the interview. We talked about the pros and cons of each. There's one popular coconut product that actually has little or no value for brain health. So when you tune in tomorrow, you'll get all that, plus recipe ideas using coconut oil. The interview is available at 9 in the morning Eastern Time, and it will be up for 24 hours. So check your emails in the morning for the link, and I'll see you then.
Please consider supporting our important mission by choosing to own a copy of Regain Your Brain for yourself. You'll receive all the valuable therapies in the interviews and many more additional gifts and benefits. Your purchase will help us continue to bring this vital, important information to more people. Just click on one of the banners below and join us in our mission.